What if a patient doesn't want to hassle with the removable options anymore? Are there any permanent solutions?
So we have the ability to take away that framework and to replace it with something permanent and fixed, so they do not need to wear anything removable. Absolutely no adhesive, no glue. You wouldn't have to remove it and clean it. It functions and looks and behaves in the mouth as if it's your own teeth.
So what about people that are missing all of their teeth? I know a lot of people have dentures and they hate them. You know, it covers your palate, they don't stay in place, you have to deal with all those glues. What can we do to help them?
Typically, we see a lot of patients that come into our clinics with dentures, but we're lucky that we have a lot of good solutions.
Hand them over, baby.
Hand them over. There you go.
Great transitional thing to get us to where we are, right? But this palate, it's out of here.
If we want to go the most economic route, add 2 implants, sometimes 3.
In this particular instance, we'll place 2 implants on the lower jaw, or 4. And we'll put 2 pieces inside the denture, and what that allows us to do is snaps in place.
In which we call the clip-on or snap-on denture.
Ah, so it holds it in place, you can chew your food better, you don't need all those nasty glues, and it's more realistic.
You get stability. It doesn't move.
Okay.
The tongue doesn't clunk it out of the way. These are 2 huge factors.
On the upper dentures, the most common complaint is the palate. This piece of plastic covers the patient's palate. It precludes them and prevents them from enjoying texture of food, temperature of food, and most of all, taste. It's wobbly, it drops out when I smile or laugh. It's just not stable. They can't chew their food. They have to use a lot of glue inside it to keep it in place. It stinks, it causes an odor, it's yellow, discolored. Nothing but complaints.
On the upper jaw, you get to eliminate that hard palate of acrylic so you can actually taste food.
So this is the most economic way of solving problems with dentures that are sore, painful, unstable. You can't chew with them. They keep jumping around out of your mouth. That's usually the typical complaint.
That definitely sounds like a better option than dentures.